Hi, this is Dr. Jerry Hesch from Hesch Institute in Aurora, Colorado. I am an orthopedic manual physical therapist. I treat the person, I treat the nervous system, I treat movement, and therefore I treat joints also. And the traditional belief about the way that the Occipitoatlantal joint moves, which is the joint where the occiput joins the first cervical vertebrae, the traditional model suggests that the occiput does flex and extend a considerable amount, about 10 degrees, but that when it side bends, say to the right, it rotates the opposite way, but it doesn't move very much in that context. But it does move enough that you can feel that motion with gentle spring testing, and you can stabilize, the joint below. I'm blocking her C1. I'm taking up all the slack at C1. I'm on top of the mastoid. Okay, and I can get a little tiny bit of play. I don't think you're seeing the movement, but I feel a little give, a little recoil. Okay, now she's positioned with her head a little bit asymmetrically, and if I just test gross movement and test side bending, there's a certain rigidity, especially gliding over to the right. Okay. When I test rotation left and right, she does have that movement on both sides. But when I come under the mastoid, which is the way to get to the occiput indirectly, when I test side bending, she's blocked on the right side. So my conclusion is, and it's lower, it is lower on the right. This is an exaggeration, okay? So we have to look at anatomy a little bit deeper. And we need to look at anthropology. Anthropologists published a book on joints in the body that develop different from the norm. And her study was on Southwest Indians, and she found that more than 30% had significant asymmetry of development of the occipitoatlantal joint and even the second joint, the atlantoaxial joint, C1, C2. The anatomy supports that as well. There's been a couple of published studies. But if you go look at a traditional manual therapy on the spine book, I don't think you're going to find that information there. Some of my information comes empirically by me testing different movements. I don't think you'll see these subtle little spring tests either in those directions. But she doesn't spring upward, and positionally it's lower on the right. And the way to isolate those upper joints in order to traction them, get a little gapping in them, it requires a force that goes to the front of the neck instead of the back. The facet joints are in the back of the neck below those joints. So you'll see people doing traction contacting the occiput and putting it in flexion. But in order to traction those joints, I need to get my contact on your temples. Okay? And so this is the main contact is with the palms of my hand. And I'm going to do a gentle stretch. Okay? And then I'm going to add side bending to the left. It's really subtle, but I bent your head sideways to the left. And I'm just going to maintain a firm, although gentle. I mean, I'm only pulling with about 15 pounds of force. And I'm going to maintain that for just about a minute. So I'll go another 30 seconds. Of course, technically, weight also has the effect of gravity acting on it. So technically, it's really hard to say I'm applying 30 pounds of force in this direction if you want to really get technical. But I think for most of us, it works. If you grab a fish scale and you pull it with both hands, at 15 pounds, you'll know what I'm talking about. You can reproduce this. And so I think we can ignore precise semantics for the purpose of a YouTube video. But someone's going to jump in and slap me on the side of the head. Good. All right. I'm going to give you your head back. Keep filming. And I'm going to come underneath that. the muscle tone feels better, and now we have that joint play. Okay, that easy, I'm doing the most minimal force, and I feel that little spring there. Let's have you walk. Oh, but stay there, stay there. It was also quite tight coming this way, and I don't feel that little catch. Go ahead and walk down.
Wow, that's nice.
What is it?
Feel loose. I'm not. My neck feels better. I didn't know I had a problem there.
Beautiful. I like it. So it should stay.
Okay.
I call my work corrections. Unfortunately, I don't have 100-year study. 100 years later, someone is still better. But I do follow folks, and I have enough history to be able to make that statement.
And it was just a little bit of movement that all you did was...
Yeah. And if you were to need to treat yourself, and you could do this, I'll have you do this at least 3 times, maybe once a week for 3 weeks. What I'm going to have you do is lay with your head hanging off the bed, okay? And so you're going to just let it side bend, just purely side bend to the left like that.
To the left. So I'm on my left side.
Yeah.
Okay.
Yeah, so it's going to the left. And if you want to accentuate it, you can very gently take your hand on the temple. Remember, it's in front of the ear, okay? And then just add the smallest little force.
Okay.
I think I'm pushing with 5 pounds of force.
So like a minute?
2 minutes. I like 2 minutes.
Like once a week?
Yeah, do this once a week for 3 weeks.
Okay.
Okay? And that might be more of a soft tissue effect, because I don't think the joint is going to get restricted again. But anyway, yeah, very interesting. And let me ask you another question. Keep filming. How does your jaw feel?
It feels not as tight as it usually is. I feel like tension in it all the time.
Got it. So yeah, the jaw is the last thing you should treat. And I told you the story of a woman that was telling everybody for 15 years, it started in my foot, then it worked its way up. And she developed TMJ syndrome. Okay.
I had that when I was 19.
Oh my.
TMJ.
My.
I had braces for it too.
Wow.
So, and then that's why I wear the retainer, the night guard.
Okay. Okay. I'll be curious to see how it feels now.
Yeah.
But anyway, she said for 15 years, I told all the, whoever I would see for treatment, I would tell them that, and they would say that doesn't make any sense. And I thought it made perfect sense. And she did have a restriction in 2 joints in her foot and ankle, and I freed them up, and bam, her jaw released.
Wow, that's awesome.
Yeah, she got up and walked around. She said, oh my God, everything is loose now. And I rechecked the jaw. I thought I was going to have to treat it specifically. No, it let go. So, these things are connected, and we have to look at the body through a whole body paradigm. It shouldn't just be words we throw around, But let's keep filming. Let me look at your jaw.
Okay.
Line your back. So I put the head in slight extension, and that kind of opens the jaw naturally. Okay? Good. Just relax. So I come underneath the mandible. Okay? Just below the ear. I come underneath each side, and the tone feels very symmetrical. And I just spring it left, and I spring it right. And then I come underneath it, and they feel fairly symmetrical. I spring vertically, just relax. And I would say that there is a mild tightness there on both sides, okay? I've seen worse.
Okay.
Okay. What's interesting is that so many treat the jaw joint in the mouth, okay? When you put your fingers in my mouth, I feel a little on alert. It's hard for me to relax. And it's very challenging to get your mouth in there and, jiggle the joint, blah, blah, blah. An external approach is so simple. For hygiene, some people are more comfortable if you're working outside their mouth, This technique is so effective on so many patients. I think that internal work should be done for soft tissue effect, but I'm not a fan of trying to mobilize the joint internally because I can do it so effectively externally. Okay, so I'm going to come in front of the earlobe because the jaw joint is right above it. Okay, so I'm going to come here to that vertical part of the jaw. Okay, I'm going to contact it and just glide it downward. Okay, and I'm going to do that for 2 minutes, and I'll show you on the skeletal model here. It's on this part of the mandible where I make contact.
That's the bottom of the jaw, yeah.
Yeah,
Okay.
yeah, below the joint. Okay, so I'm going to just do that ever so gently. I'm going to take about 5 pounds of force total. Okay, and I'm going to maintain that for 2 minutes, and then we'll come back and see how you feel. Okay, so we can stop filming.